Hi, my name is Dr. Treat Tinnitus, and you're watching How to Treat Intelligently. And today's topic is on tinnitus, or ringing in your ears. So the first thing you have to think about is what's causing this in the first place. And so the two main causes of tinnitus or ringing in your ears are oxidative stress, which is a type of inflammation inside your inner ear, and also poor circulation. So there's a few reasons why you could have poor circulation to your ears, causing tinnitus. One is you could have thick blood, and over the past 2 years, there's been a lot of patients for certain reasons whose blood is thicker than it should be. So over the past 2 years, there's been a lot of people that have either gotten COVID or have been exposed to spike proteins. And unfortunately, what happens is a lot of these people, their blood becomes thick. You actually get fiber in your blood that starts sticking together. So what you have to do is you have to take an enzyme to digest this fiber or fibrin that's in your blood. And one of my favorite supplements to do this is called nattokinase. Nattokinase, okay, just to give you an example. And what it does, basically, it goes in, it digests the fiber in your blood, improves circulation. So this can be a cause for tinnitus, because if you're not getting good circulation to your ears, you get tinnitus. A second thing that you can also check for the circulation in your inner ears is to do a human N test strip, checking for nitric oxide levels, okay? Nitric oxide is naturally made in your body, and what it does is it expands blood vessels. So you get improved circulation everywhere if you have normal nitric oxide levels. I would suggest picking these up online. It's a little saliva test that you do in the morning. First thing in the morning, you get up, you spit on this little strip, and you do it for about a week, and you see if you've got normal or low nitric oxide levels. If you have low nitric oxide levels, that means you could be getting poor circulation to your inner ear. And so then what you want to do is to take a supplement that will increase NO, nitric oxide. Here's an example, one right here, Nova, okay? It's a powder, works really good. So what else? What else can you take to improve circulation to your inner ear? Well, there's these two supplements. One's called ginkgo biloba, and the other one's called vinpocetine. Both of them will increase circulation to your inner ear, and actually they'll increase circulation to your brain too, so you get 2 for 1. So those are 3 different supplements that can help with improved circulation to your ear. Now, how do you improve oxidative stress or inflammation in your inner ear? Well, there are studies that show that just taking simple everyday vitamin C can help with tinnitus. Now, I'm not talking about taking 500 milligrams. We're talking, you're doing anywhere from 3,000 to 5,000 milligrams per day of vitamin C. And this usually isn't a problem unless you start having some loose stools or diarrhea, then you cut down your dose. But these are all things that can help with your tinnitus. Now, what else can you do? Well, laser treatments or photobiomodulation to your ear can also improve tinnitus, because it's increasing circulation to your ear, it's decreasing inflammation, and it's also increasing local growth factors to help repair your inner ear. You also get increased melatonin production in the area, and melatonin is your body's main antioxidant, so this is also helping with oxidative stress. Usually this is something where you have to do 2 treatments a week for 6 to 12 treatments. And then you may not need to have any treatments after that. You might be able to just get by with the supplements we were talking about earlier. You can also add to this doing hyperbaric treatments, which is a dive chamber where you go in for about an hour once a week for anywhere from 10 to 12 weeks. And what the hyperbaric chamber does is it also improves circulation and oxygen to your inner ears, and it decreases inflammation. I'll have more information down below on all these different treatments and links where you can follow. You've been watching Dr. Treat Tinnitus and How to Treat Intelligently. Take care.